everyone. Hope you are doing very well today. Hope you're having a good day. I'm Dr. Rabi Labaran Nangambo, and today I'm going to be talking about a topic that we're hearing a lot about in this month of October. October is the pink month, and a lot of sensitization is going out on breast cancer. So I thought, why not? Let me give a little briefing, a little education on breast cancer and sensitize people. Actually, the aim of all this sensitization, all this education that goes out during this month of October is for us to learn how to prevent having breast cancer and also for early diagnosis so that treatment can start off early enough. Because if you're diagnosed early before you start having symptoms, there's a higher probability of survival rate than when diagnosed later on. So breast cancer is the most globally diagnosed cancer in all areas of the world, and about 30% of breast cancer diagnoses are caused by modifiable risk factors, meaning about 30% of women or 30% of people who have breast cancer are caused by factors that they can do something about, they can be modified. So about 60% of risk factors cannot be modified and you can't do anything about it. But about 30% of people who are diagnosed of breast cancer are caused by modifiable risk factors. That is factors that you can change something about, factors that you can do something about. And also, just for statistics, every 50 seconds, a woman somewhere in the world dies from breast cancer. Yes, I know this sounds like a very scary information, but the goal of all the information that you'll be hearing around the world from people on people's statuses is so that we know. It's better to know, to diagnose early and start treatment early than to be afraid and only go to the hospital when you're having symptoms. So the aim of all this education is not to scare us, but to bring us information that we should be aware as women of what we can do to prevent and what we can do to early detect if we are having some abnormalities in the breast so that we can go to the hospital early enough. Now, breast cancer can occur even in males. About 3% of males can also have breast cancer. So it's not only a disease for women, though it's more common in women. So I would like to talk about a few things like the risk factors that we can modify. So we can try to prevent, because there are some factors that you can modify. For example, usually if you have a first degree relative with breast cancer, you have a higher risk or a higher chance of developing a breast cancer. Even though there are about 40% of women who develop breast cancer with no family history of breast cancer. So what are the things that you can do to prevent yourself from having a breast cancer? The first thing is maintain a healthy weight. Another thing you can do is avoid harmful use of alcohol, excessive drinking of alcohol. Also, you can avoid tobacco use, that's smoking. Also, you can avoid, we need to make sure as women we avoid prolonged use of hormones. Like women who take hormones for a very long time, you're exposing yourself or you're increasing your risk of having breast cancer. Also, breastfeeding has been known to protect women from breast cancer. So if you have children, breastfeed your own children. It has a protective mechanism towards breast cancer. I also like to talk in this video about some of the signs that you can notice, and if you notice those signs, they are like alert for you to go to the hospital or ask more questions or be more inquisitive. In fact, go to the hospital. One of those signs include noticing a lump in your breast. Disclaimer, not all lumps are breast cancers. Not all lumps in your breast. If you have a lump in your breast, it doesn't mean that you have a cancer. It can mean that you have a cancer, but not necessarily a cancer. So one of the signs that should alert you is if you notice a lump in your breast. If you notice that your nipple starts going inward, that could also be a sign that something is wrong and you need to see a doctor. Another thing is, we all know the skin of an orange. If you notice that your nipple, around your nipple or a part of your breast is beginning to have that dimple-like feeling. We all know how the skin of an orange is. So if you notice those signs on your breast, it's also a sign that you need to go to the hospital. Another thing is if you have discharges if you have discharges from the breast, if you're not breastfeeding, you should think that that could be an alert sign that something is wrong. Also, if you start having pain, or you notice that your breast is no longer the way it usually was. For example, one breast is getting way bigger than the other one, it can be a sign. Or you notice some changes in your breast, the color of your breast, any changes in your breast, please, it's an alert sign. You need to go to see your doctor. Lastly, I would just like to say one of the ways among the other ways that we can diagnose breast cancer, this one you don't need to go to the hospital, or one of the ways to screen, one of the ways to test, one of the ways to see if something is wrong in your breast is what we call the self-breast examination. Now, how do you do a self-breast exam? Usually it's important that women learn how to examine their breast by themselves. For example, while taking your bath, before you take your bath, every month you can stand on the mirror and just palpate, touch your breast to see if there's any abnormality. Okay, so it's advisable usually to stand in front of the mirror and first start by looking at the two breasts and seeing if there's any difference. Usually you will easily notice a difference when you're looking at two identical things at the same time. So for you to notice if there's a change in one of your breast size or breast color, it's important that you stand and look at the two breasts at the same time. That way you can easily notice if one is way bigger than the other one, or there's a particular change on one of your breasts. So after looking at the breast just to see the symmetry, usually it's encouraged that you put your two hands behind your head like this. That way if there's any lump or anything, it makes it more visible. So when you stand in front of the mirror, you put your two hands behind your head and you look at the symmetry if the two breasts are the same. Now the next step that you do in a breast self-exam is to put the one hand behind your head and use the other hand to palpate the breast where the hand is, because when your hand is behind your head, it makes your breast to be firmer on the skeleton, on your chest. So when you put one hand on your breast, you palpate means touch. You touch the breast in a circular motion all around so that you can notice if there's any lump in any of the breast. You touch circular and go round, just like how you can do like a clockwise motion. You touch circular, touch. When you're done with this side, you put down this hand, you put the other hand behind your head, and you start to touch with the other hand. Now, this is very important as a woman to do. I know most of us are scared about this information and we are like, okay, I don't even want to try. What if I notice a lump? It's important that you try so that you can know the normal, so that you can easily notice when there's an abnormal. Sometimes if you don't know what is normal, you wouldn't even know when there's an abnormality. So it's important that every woman should be able to know their breast so that you can identify when there are lumps. Normally the breast has some hard parts of it, but if there's a lump, if you know the normal structure of your breast, you will notice when there's an abnormal lump. So this is a video that calls out to all women to do their breast self-exam. Another thing in the breast self-exam is when you're finished touching around the breast, you press on the nipple to see if any fluid will come out. If a whitish fluid comes out, it can also be a sign of a problem. So what the things that you could notice that will make you feel like, let me maybe go to see my health practitioner, my doctor, is if you notice a lump in one breast that is not found in the other breast. Also, in the breast self-exam, you should make sure to touch under your armpit for any lumps, because when the breast has problems, there's usually some lumps under the armpit that will arise. So when you touch under your armpit, you notice also if there are any lumps. So I hope this video was helpful. I hope you learned something while watching this. Of course, if you have a question, you can always ask. If you have a comment, you can drop your comment about what you liked or what this video has taught you. Thank you very much.